So we were looking at 4.32 and 4.33 and 4.34. Let us focus on these three with a few examples to make it clear. Let us take a few disorders and apply this model and develop our skills. Say there is a disorder of phobia. Somebody is afraid of water. If this is the symptom that we come across, the disorder, how do we apply 3.2, 3.3, and 3.4? Anyone? Psychoanalytically, which schools can offer a causal account of phobia? It need not be one, and this brings up a very important point of the junction, that you can have the same symptom because of a variety of different causal phenomena. From many different points, you can reach the same junction. And similarly, at the junction point, when you think of healing, there may be multiplicity of choices available to you. And in the session also it happens that the client says something and you come to a junction point. There are variety of things you can do. Should you hold? Should you interpret? Should you intervene but not interpret? Should you ask for more? Should you do active containment? Should you go for catharsis? At every critical point in the session itself is a junction point. Because at every point you will have to, critical point, you will have to make a decision which school intervention to use, how intensely to use, how to word it, or to do it silently. Similarly, at the end of case study also, when you think of the therapy uh, course, the course of healing, it again is a junction point. And before that, so first we have the junction point of pathogenesis, the junction point of healing, and junction points which occur in every session. So there is no one-to-one connect that phobia of water is caused only by X. It may be caused by X, by Y, by Z, and so on. Based upon the case, we have to find out X, Y, or Z what is applicable. So let's take two examples. Two persons come, three persons come, let us say, with complaint of phobia, fear of water. And we use all the schools to find out what are the possible causal explanations. And when we try to find out causal explanations, different schools offer us a different explanation. The Freudian school will say it is the castration anxiety projected out on an innocent object, and therefore the innocent object has now become a threatening phobic object. The Kleinian school will say the attacking bad breast has now become one with the phobic object, and therefore an innocent object now appears as a threatening phobic object. Some Cohusian will say that the fear of the ocean is actually the fear of disintegrating into the unconscious, and the ocean is representing the unconscious. So it's actually a crisis of a fragile self just about to disintegrate and the unconscious to take over. And this is what is symbolized, the The fragility of the self is symbolized in the disorder of phobia. Now, each patient will have his own causality, and all these causalities of different schools obviously are true for some patient and not true for others. So there is no one-to-one in terms of causality. But let us say we have a patient in whom the case history tells us that it is most likely the unresolved Oedipus and the projection of the castration anxiety onto water that actually is the reason for phobia. And if the Oedipus is resolved, the phobia will be resolved. Then what we look at, once the we have looked at all the schools and we have found the most plausible explanation, that then becomes the core process. So what will be the core process here? The core process will be, I cannot give up the desire for the parent of the opposite gender, therefore have the fear of the parent of the same gender, therefore have the fear of castration, therefore have the fear of castration, and therefore the anxiety being unbearable, I project it onto the phobic, as innocent object, which then becomes the phobic object. So the core here is, the first critical event in this core process is desire for parent of the same gender, parent of the opposite gender. So if that was not there, rest of it would not follow. But even more critical is the second component. Even if there was a desire for the parent of the opposite gender and a belief that even if the parent of the same gender knows about it, he won't castrate and kill. He is too good for that. If there was positivity on that account, the rest of it would not have happened. So the key here is the fear of attack from the parent of the same gender because of lack of excessive positivity, because of presence of realism or pessimism. So this is the key point at which the turn takes place. That if the fear of castration from the parent of the same gender, this is the critical event. Attack from the parent of the same gender, this is the critical event. And this critical event actually generates anxiety, which later on gets projected and becomes phobia. So we have first come here to core process and then to the critical event within the core process. Take another example of say addiction. Somebody is alcoholic, knowing fully well is destroying the body, but continues to do so. Comes to the rehabilitation center, takes all the medications, but goes out and again comes back, can't control himself. Something unconscious is at work. Even though he wants to give up, he can't give up. So, what would be the psychoanalytic cause of that addiction? Different schools will give different explanations. Let us say the Freudian school will say it reminds him of the ecstatic. So if the addiction, let us say, is of alcohol, it's oral, some Freudian will say it reminds him of the ecstasy of the oral stage of being at the good breast. Some Freudian will say it is a way to manage the anxiety of castration. Some cohesion will say it is the fear of fragmentation, and it's a way of feeling the contraction in the body and the nerves to consolidate a center, create an anchor so the fragmentation does not happen. Now, let us say, given the case history, we find the fragmentation to be most likely. So, we take the cohesion explanation that a healthy self was not formed and the fragile self is in perpetual danger of fragmentation, and therefore the addiction is used as a coping mechanism to keep the fragmentation at bay. So the core then is that a fragile self is fragmenting in the face of some sort of stress, and the critical component here is the cohesive force is much lesser compared to the centrifugal forces. So if one was to look at the development of this whole thing, it will go back to the development of the healthy self. And one can find either fault in mirroring or unavailability of good enough objects in early life. And that would have set about this fragile self. So then the critical event becomes stress comes on the fragile self, and the fragile self believes it cannot handle the stress and it fragments. It catastrophizes and fragments. So the key becomes catastrophizing. If it had not catastrophized, it would not have fragmented. So the catastrophizing then becomes the critical event. Take another example. Say schizophrenia with negative symptoms. The person looks very happy from the face of it, but suffers in cycles. But there are phases when he looks very happy and contented, especially when he comes to therapy for a few sessions before he stops. So there the core is the reality is frustrating, pain giving, and there is a call from that stage of primary narcissism to which he has to regress back. So it is the pain of reality, the reality not conforming to his narcissistic demands and being too harsh, and his belief that he cannot change that reality. He is not good enough, he is not powerful enough, and that there is no hope. So the unbearability of pain and no hope are the two critical events in that phenomenon, after which the regression to primary narcissism happens and schizophrenia with negative symptoms sets in. So this is how we look at this very important part, that we take the case history, note down the disorders and the symptoms, apply all the schools of psychoanalysis, whatever we know, find out based upon the case history which school applies the best and what is the core process that school tells us is the causal process for this disorder. Note down the core process and then go in the components of the core process to find out the critical event. So this is what we do for any case we take. Now we look at 4.3.5. Generic event causation. This is where till now we have not brought in the East. All of this is classical Western psychoanalysis. Now we bring in the Eastern part, right? The Eastern philosophy, specifically the Hindu spiritual philosophy, and This is where you go into 4.3.5. In 4.3.5, we look at the generic event causation. And the idea here is, why should any event happen at all? And the event which is responsible for generating the pathology, the traumatic event, that also is an event like any other event. And therefore, if we have a generic formula for any event, that can be applied to a traumatic event also. And that gives us some more insights. Let us look at what it gives us. So this is the generic event model, causation model. So we are saying any event can be caused by any of these forces or a combination of them. So based upon the case, experience and intuition, we can think of whether somebody is suffering because of the way things happen and laws of nature, or can there be something else? When we talk of Western psychoanalysis and pure science as we call it, we are talking of point number 9, laws of nature. And when we talk of psychoanalysis, we essentially talk of point number 9, point number 6 and 7. Rest of it we don't consider. But the moment you come into the Eastern side, everything becomes important. So when we take a case, we can go into, why has this sickness happened to that person? Is it because of journey of self that he had to experience this? Is it because of karma of self, karma of others, free will of self, free will of others, and so on? And this includes suprahuman forces and beings, which the Eastern approach takes very seriously as one of the causal factors in pathology. So it can be one of them, it can be multiplicity of them. Now, what is usually not at work is point number 2, point number 5, point number 8, 10, and 11. Usually, for 99.99% of cases, they don't apply. They are very, very rare occurrences. In fact, when you see a person and the case, intuitively you start feeling which of this may be at work. And the most common will be 1, 2, 3, 4. This will be the most common factors at work. Any question on this?
No, sir.
One of the difficult questions here is, how do you know if 3 or 4 are at work? So there is no scientific way of knowing it. It is essentially based upon intuition, experience, and there are some mystical systems which help you to make out whether something is at work or not. For example, in pranic healing, there are techniques which tell you in terms of yes and no whether something is at work or not. So those things can be used to complement it. And if somebody does not believe in all of this model is very modular. You can remove the believing part and just proceed with the experiential, existential, secular part. That also is possible. Then we get into the epistemological analysis of the critical event. In the generic event causation, we can ask ourselves, why has the critical event happened? Because the critical event ultimately leads to the pathology. So we can apply this model of generic causation to find out, did the critical event happen because of scientific laws only? Did it happen because of your free will wrongly used? Did it happen because of self journey, karma, or anything? So we apply generic causation model to critical event, and we also apply the epistemological analysis to critical event. Now, what is the epistemological analysis? We do essentially the first two, third is optional. The cognitive process analysis and the affective analysis. What do we mean by this? This is the table which tells us how to do the cognitive epistemological analysis of the event. For example, uh, we saw in the example, I love you got converted to I hate you. So what happened there? It was operation of guilt, operation of. So the moment I love you happens, guilt comes in and says this is not acceptable. And what has happened demands that huge amount of rage has to be generated against the self. The self deserves to be punished. And the rage then has to be projected somewhere else outside. So this recognition by superego that what has happened in the mind is unacceptable and calls for self-punishment, and a very harsh self-punishment. This thinking process ultimately leads to the call for the defense of reaction formation, and then the whole story goes. So this thinking we put in this, and we have seen last time how Immanuel Kant gave this model of thinking. So here we put something in conception. So it is all in the conception and knowledge that all this thinking happens. And these two will lead to the traumatic event. Similarly, when it comes to affect, let's say we are looking at a hydraulic system, then we use this table to find out how affect was generated. For example, the moment I love you is seen by the mind, huge amount of guilt is generated. Why huge amount of guilt? Why not less amount of guilt? Because that is interpreted by the superego. And the superego says what has happened is not mild or moderate, it is severe. And for unit occurrence of this severe event, so much guilt has to be generated. Because so much of it has happened, huge amount of guilt is generated. So how much guilt has to be mobilized is based upon analysis of what has happened. And that evaluation is what is here. That how do we decide how much affect is to be generated? So it is not only the action, it is also the evaluation. For example, if I'm playing with a small child, say 1 year of age, and he slaps me, I don't generate rage. But if somebody elder to me slaps me, I generate huge amount of rage. So it's not slapping, it's the evaluation of slapping in a particular context. And the components of that evaluation are given here in this table. When we take up cases, we will see how to apply all of this. We'll apply this to 10-15 cases and it will become very clear. So this is the entire detailed way we analyze a case in heat. We do the core process analysis, critical event analysis, general causality analysis of the critical event, epistemological analysis of the critical event, and lastly, we use the model of the mind of heat to find out how functionally this would have happened, the trauma would have happened in the mind. So in core process analysis, what we do is, first we do the episode analysis. That we list out all the episodes in the table. And there are many kinds of episodes. the person comes to us with the most recent episode. Then there can be a very important episode or a very extreme episode which is not the present episode. Then there would be the first episode of Genesis. And then we would look at the theory and find out in this kind of situation, what is the generic episode like? So we put that into this table. Don't worry about the complexity of it. When you apply it 10-15 times, it becomes very natural. So when you take case studies, take as many episodes as possible so we can fill up this table of episodes. Then out of so many episodes, we take up one for analysis, which we call the episode of focus. And then we go only in detail of that focus analysis, episode of focus. Then we also analyze the critical event in terms of why has the critical event happened, right? How much part constitution has played, how much environment has played, how much defenses have played, how much capacity has played. Then the same thing applied to critical event. This is how the affect generation is analyzed. We can undergo a change. We'll start with this. And this is the core epistemological events, elementals involved in the critical event. This is not really necessary unless you are deeply interested in philosophy, but I have put it here for my own interest. Why I put it is because of this. You don't have to go into it. And then the heat functional analysis, that in terms of Heat's model of the mind, how do we look at it? For example, if we were to analyze the process of uh, I love you converting to I hate you, how would the process would have happened in the system? So if you apply the chakra system, if you apply the Western systems, and you create a collective model of the mind, how do you apply? So what would have happened there is the yin and yang of the person, of the male, has a stronger yin. The femininity is more. That in turn creates desire for the handsome man. And then as the desire starts getting into the heart chakra and says, I love you, and in the Swadhisthana chakra, which creates the erotic desire. The moment these two happen, the superego function in the Agnya chakra then starts and starts evaluating what has happened and comes back with a decision which invokes the root chakra to create rage against oneself for punishment. And then the Agnya chakra itself for self-preservation uses the defenses to throw it out on somebody else, and therefore the delusion of persecution. So we can see how in the heat model, the traumatic event would have functionally happened using so many structures and moving from one point to another. So that we will put the heat model on the screen and we will see how it goes. How the traumatic event would have functionally occurred in the heat system. So this gives us a very different picture. And after this, these are the functional component of the heat model. We'll explain it later. And at the end, we will go for holistic healing. That for each of the 5 bodies or 7 bodies, physical, energy, emotional, thought, and all these 7 elements, right? What are the schools which offer us some help, and how do we use what is given by each of these schools to create a holistic healing plan for a given patient? So when we have a specific case study and we apply all of this, it will become much clearer than in the abstract sense. But I wanted you to get introduced to it, so next time we can take up cases and move from the abstract to the concrete. Any question? You can see how detailed the analysis will go, and at the end of it, we'll really get a grip on that case conceptually. That will help us to do very effective healing, whether it is only psychotherapy, it's psychotherapy and yoga, psychotherapy and homeopathy, whatever is the holistic healing package, but we will have a grip over it because we know very thoroughly what we are dealing with. Any questions?
No, sir.
Fine. Who will bring the case next time?
So I'll bring, but इसमें कोई भी केस चलेगा सर? या एक मैंने आपको से डिस्कस किया था शिजोफ्रेनिया.
हाँ, तो अगली बार वो लेते हैं स्किज़ोफ्रेनिया वाला, बिकॉज स्प्लिट ऑपरेट होगा.
ओके ओके सर.
So let us take that case next time. Just make a list of
Yeah.
as many episodes as you can, ताकि वो एपिसोड्स का
Okay.
टेबल.
हम्म. सर एपिसोड्स में जैसे यही तो जब उसको ये मतलब इस तरह का उसने सिम्टम्स बताए हैं अभी एपिसोड्स, तो मतलब ये काफी टाइम से चल रहा है उसको, तो
उसको पूछो कि ये सबसे अर्लियर, अभी आप मेरे पास आए हो तो कितने दिन पहले एक्सट्रीम एपिसोड हुआ था आपको, तो बताएगा
ओके
कि 2 महीने पहले हुआ था. तो पूछो क्या क्या हुआ था उस टाइम पे, तो उस वक्त उसको क्या
ओके
थॉट्स थे, क्या फीलिंग्स थे, उसके एक्शन क्या थे, वो नोट कर लो उस एपिसोड में.
ओके
फिर उसको पूछो
ओके
इससे पहले ऐसा कब हुआ था जब एकदम फ्लोरिड कोई चीज हुई हो, तो वो कहेगा कि 3 साल पहले ऐसा हुआ था. तो उसको पूछो तब क्या
हम्म.
थॉट्स थे, फीलिंग्स थे, बिहेवियर था, क्या क्या था. हर बार क्या होगा,
हाँ हाँ.
उसको कुछ इमेजिनेशन होगी, कोई स्टोरी होगी, कुछ मन में आएगा, कुछ वो करेगा, कुछ बोलेगा.
हम्म.
तो जो हर
ओके.
एपिसोड की स्टोरी होगी. और
ऑल
जब
राइट.
जब हम एपिसोड की स्टोरीज को उस टेबल में रखते हैं, तो इट गिव्स अस लॉट ऑफ इनसाइट्स how the episodes are changing from one episode to the other, which means how the pathology is developing or undergoing a remission.
ओके
और उससे सबसे पहले पूछना कि सबसे पहली बार लाइफ में कब हुआ था.
ओके सर. वो
so
तो सब है मेरे पास.
so the
आई
first time,
आस्क.
so the first episode will be what we call the episode of genesis.
हम्म.
उसके बाद बहुत सारे एपिसोड हुए होंगे और एक लास्ट एपिसोड हुआ होगा जिसको लेके वो हमारे पास आया होगा.
यस.
So वहां पे what we will do is कि we can focus on the present episode, or we can take up any other episode for analysis, whatever is our judgment, and that becomes the episode of focus.
ओके.
ठीक है, तो अगली बार we will take up your case and let us apply this model. Once we apply 10-15 times, it will be
हम्म.
very easy and automatic, and you will see how detailed it is and how to the core of the thing it moves.
ओके सर.
Okay, then
ओके.
let us
थैंक
stop for the
Okay.
day.
Thank you, sir.
Thank you.
यू.
Thank you, sir.